Ma'am. Hello.
Hi,
My name is Jennifer. I'm going to be your nurse. Can you tell me your name and last name?
Jessica Van Beers.
All right. And tell me your date of birth.
July 5th, 1984.
All right. What's today's year?
2016.
All right. And can you tell me who's the president?
Obama?
All right. Um, what we're going to do today is I'm going to do a physical assessment. I'm going to do a head-to-toe assessment. And I'm going to ask you some questions. And I'm also going to palpate some areas. So if you have any tenders and a pain when I'm doing this, I want you to let me know.
Okay.
All right, I'm also going to give you three words, and I want you to remember, let me know. I'm going to ask you, tell me those 3 words in our dog, cat, and blanket.
Okay.
All right, so what I want to do now, just a few questions. Are you having any pain right now?
No.
No, have you been having any pain
No.
at all? No, okay. Any tinglings?
No.
No. Any numbness anywhere?
No.
Okay. So I want you to close your eyes, and I'm going to touch you, and I want you to tell me where I'm touching you. Okay?
Okay. Left shoulder. Right knee. Right shoulder. Left knee.
All right. So patient denies any numbness and tingling. She is veterinarian 2004. Her speech is clear. Her 5 motor skills are intact, and she's able to respond to verbal commands. So what I want you to do now is I'm going to check your eyes. Do you use any contacts or any glasses?
No.
What about to read?
No.
Have you having any visual problems lately?
No.
No. Okay. So with my pet light, I want you to follow my pet light.
Okay.
Good. Now I'm gonna with the light. Use my light. So now so her pupils are equal and react to light, and then accommodate to light, and so she's Perla, and then what I wanted to do is I'm gonna check your peripheral vision. So let me know when you can see my fingers.
No.
All right, so she has good peripheral vision, and what I'm going to do now is I'm going to check your ears. Have you having any ear problems?
No.
No. Any drainage in your ear?
No.
Nothing. I'm going to whistle a word in your ear, and I want you to tell me what it is.
Wiggle.
Okay, good. So so what I'm going to do right now, so she denies any hearing problems. Check your ears. Alright, so there's no drainage in her ears, and no lesions. I'm going to go ahead and put my gloves on, and I'm going to check I'm going to touch your sinus, and then let me know, are you having any pain? Does it hurt
No.
right here?
No.
Right here?
No.
Alright, so I'm going to check your skull, and your hair. So her hair is symmetrical. There's no lesions. I'm also going to check for. I'm gonna palpate your thyroid, and go ahead and swallow. All right, so she had a good swallow, and there's no lesions, and any pain when I was doing that?
No.
And there's no pain. All right, so now what I'm gonna do, I'm gonna check your lungs, and from what I see up in inspection is that she is breathing without using her accessory muscles. There's no, do you smoke?
No.
All right. They're having any cough lately?
No.
No. Any difficulty breathing?
No.
All right. So patient denies any difficulty breathing, any cough. She doesn't smoke. So they her equal. She's breathing without any without using her accessory muscles, and she doesn't look like she's in any distress. So what I'm gonna do, I'm gonna listen to your lungs from the back and the front. Okay. So go ahead and move this way. Good. Move more. Yeah. So, and I'm going to ask you to take deep breath. Okay?
Okay.
Take a deep breath. Good. Again. Good. Okay. Again. Look at me. Good. Deep breath. Okay. Okay, lungs are clear, bilateral. There's no wheezing, no crackles. So that's good. So what I'm going to do right now, I'm going to check your oral cavity. So go ahead and smile for me. All right, tongue out. All right, I smile again. So her mucus is pink, is moist. Her lips, there's no, they're moist as well. They're pink. There's no lesions. Her tongue is midline. So, any problems with your teeth or anything?
No.
All right, good. So, now what I'm going to do is I'm going to check your abdomen.
Okay.
So, if you can lay down for me. I'm going to lift your... All right, and go ahead and, okay. So, up in inspection, I see that her abdomen, it is pink. There's no lesions. And so I'm going to listen for each quadrant on your abdomen for at least 15 seconds. Good. So now I'm going to palpate your abdomen, and I want you to let me know if you have any tenderness.
Okay.
Any tenderness?
No.
No pain?
No.
All right. So her bowel signs are active. They her abdomen is flat and is soft, and she denies any tenderness or any pain. Go ahead and sit down for me again. And I'm going to check your, thank you. And I'm going to check your pulses. Okay? So I'm checking for her radial pulses. All right, radial pulses are equal. All right, capillary refills are less than 3 seconds. Let me see your legs. Let me see her leg. All right. And this whole time I have my gloves on. Go ahead and put your legs on. All right. There's no no edema, and now I'm gonna check for her lower pulse. Her pulses, pedal pulses are equal and strong. And capillary refills in her lower extremities are also less than 3 seconds. All right, so I'm going to check for your range of motion now. So what I wanted you to do is move your right arm in circles. Any pain, anything?
No.
No. Okay, now move your wrist in circles. All right, now move your arm like this. Good. Any pain?
No.
Nothing? No difficulty, nothing?
No.
Now do your left, the same thing. Good. Now your wrist. And your... Good. So there's no nothing?
No.
No crepitus, no pain, no tenderness.
No.
Go ahead and stand up for me. And walk from here to there and there back. So her gait is steady. So now what I wanted to do is come back over here. So look at me. Okay. So I want you to move your arms. I'm sorry, your legs, and then go like this. All right. Now the other one. Any pain or anything?
No.
All right. So she has full range of motion in her lower extremities and in her upper extremities and lower extremities. So let me see your back. So what I'm gonna do now is I'm gonna check for check for your spine. All right, and then now so there's no your spine is straight. There's no deformities, and so that's good. Go ahead and sit down again for me. All right. So did I ask you if have you had any chest pain?
You asked me. No.
No chest pain. Okay. All right. So we said no pain, and all right. So let me ask you a few more questions. Any problems with your abdomen or anything?
No.
When was your last bowel movement?
This morning.
This morning. Okay. And was it normal? Okay.
Yes.
Okay. Soft. How was your abdomen? Your
normal.
Okay. Good. All right. So now I think we pretty much did everything. Any problems with your hips or anything? No. Okay. All right. So I think we're good. So what we're gonna do now is just repeat the 3 words that I asked you to remember.
Dog, cat, blanket.
Good. Her memory is intact.